course, already for a long time, patients and practitioners assume that the root canal treated teeth are causing harm to the body. The problem is how to prove it. So the amount of toxins which leak out of the tooth into the bone and into the body is quite low. It's very difficult to detect them, and also the bacteria are then basically attacked by the immune system. We know all this. I mean, we are 100% sure that root canal treated teeth create a problem, but it's very difficult with the techniques of laboratory medicine to prove this. So my lecture deals with the effects of the root canal treated tooth on the surrounding bone, and on the surrounding bone you can see exactly that something happens and what the bone is doing to prevent a spreading of the problem. That's why this lecture is called "The Bone Tells the Truth About Root Canal Treated Teeth." So root canal treated teeth lead to a very visible reaction in the surrounding bone. Around these roots you see that there must be bacterial infection and an intoxication, and this is actually close to the bone. The root canal is close to the bone, is only separated by the desmodontal gap, and such reactions can be seen. Here you see a root canal treated tooth, so actually you see the root canal filled with the dye. All these big canals are actually not so much the problem. They can be cleaned, they can be disinfected, and all the soft tissues can be taken out, but you see that there are small canals between the big root canals, and you don't see on this picture, unfortunately, the thousands of canals which are developing around the apex of these teeth. So the apex is actually the top part, which is deep inside the bone. This can never be cleaned, this can never be disinfected, and that's where the problem is. Problem is also that necrosis happens, so the soft tissues will die as soon as these root canal are emptied. So if the vessels, especially the arteries, are being taken out, the tissues die, and this necrotic tissue creates the problem. Necrotic tissues usually are removed from the body. And please don't confuse these topics which I now talk about with these old concepts of Chinese medicine, where specific teeth are connected through meridians to organs. So this is a completely different story. This is not what I want to discuss here. I would like to point out, however, that toxins from every root canal treated tooth will create damage in the body constantly. So the root canal treated teeth are a self-filling reservoir for toxins and bacteria. So it's not that the bacteria leak out and then there are no bacteria anymore. The opposite is true. In this necrotic root canal area, the bacteria are reduplicating themselves constantly and over years, and this is what makes the intoxication and the infection. Here you see an example of a foot which became necrotic for whatever reasons. So there's no point. Actually, it is dangerous to keep this part of the foot there. So it is automatically resected. Everywhere in medicine, necrotic parts or parts of organs are being resected. Only, unfortunately, in the root canals, the doctors accept that these necrotic parts remain. And this is an exception, and this exception cannot be justified because the problems are the same in a necrotic tooth just as in the necrotic limb. Here you see a bridge with two teeth, and as you see in the area of the apex of the teeth, where for those teeth no access for oxygen was given, the roots still have their regular color. They are like yellowish or orange. And in the upper part of these roots, you see a severe oxygenization, and there you see the necrosis of the tooth substance. The necrosis is, of course, inside the tooth, and we cannot take it out. We have to remove this tooth, of course. I want to show you an example which is very clear about the effects of infections close to the bone. I'm talking about infections close to the bone and not infections in the bone. So I'm not saying that the root canal treatment will create osteomyelitic situation, but as you see in the right side of the picture, inside the maxillary sinus, a necrotic part of bone was left over. It was there for 10 or 15 years when this picture was taken. And as you see, there's a lot of granulation inside the maxillary sinus, and this chronic granulation over so many years has created a thickness of the bone structure around the maxillary sinus. Actually, on all sides you see more bone and highly mineralized bone, and that's how we can see that the infection is there. So on the CBCT we cannot see the infection, we only see black and white. But if we compare the structure of the maxillary sinus on the left and the right side, it's of course clear that this infection inside the maxillary sinus must have been there for many years, 10-15 years. So the bone shows reaction which we can identify, and we know exactly what this means. Here you see the same around the root canal treated tooth. You see on the left root an osteolytic areal. So osteolysis is a situation where blood vessels are being built through the bone towards the tooth, and there is an immune reaction. T cell, B cells, lymphocytes and so on are active there, and they are fighting the infection and they are fighting the bacteria. And this type of granulation doesn't heal. It's not that the body is finished with fighting the bacteria after, I don't know, 1 week or half a year or 2 years. This infection is going to stay there forever. On the right root you see a hypercementation, hypermineralization actually, and this means that the body and the bone is trying to encapsulate this tooth because the toxins and the bacteria are coming out, and the only way to fight this is the hypermineralization. So the bone has a possibility to fight this, and we can see this on the picture. And if we see it on the picture as you see it here now, we can be 100% sure that bacteria and toxins are leaking out of this tooth, and this is of course dangerous, and there's no point to keep this tooth in the mouth. Here's a similar situation around the apex of this lower molar, the first molar. It's root canal treated. The root canal treatment is incomplete, which doesn't matter. It can be incomplete or complete. In any case, the bacteria are leaking out, and you see that there are osteolytic areas directly around the root canals, and there is hypermineralization around these osteolytic areas. So the body is trying to encapsulate the problem. And due to the osteolysis, which we see directly around the tooth, and this encapsulation, we can be sure that there are bacteria and toxins constantly leaking out of this root canal treated tooth into the body. And keep in mind that this encapsulation, which you see, goes around the osteolytic areal, but this encapsulation doesn't block the blood flow along the desmodontal gap, so up to the mucosa, which means that although this tooth is, let's say, encapsulated by highly mineralized bone, it is still leaking into the bloodstream. And this is actually the problem. You see the same here. You see strong mineralization around the root canal. Wherever these green arrows are, you see hypermineralization. This means this tooth is the origin of massive intoxication and massive infection for the body. Now, my recommendation is to avoid root canals. If you don't find an implantologist who right away takes the tooth out and puts the implants, or if you have a problem to find the money at the moment, it's of course justifiable to have a root canal treatment done for now, but this cannot be the final treatment. The tooth has to be removed. There is no other option. And if you decide for implant, I recommend that you decide for polished implants, and these polished implants don't have a risk of perimplantitis, so there is no point to remove a root canal treated tooth and to replace this tooth by a rough surfaced implants, because rough surfaced implants will later create perimplantitis, and then as soon as you have the perimplantitis, you will understand that you have exchanged only one problem for another problem, and the infection from the root canal will be replaced by the infection from the implant. This makes no sense, of course. So my recommendation is not to do root canal treatments, to do root canal treatments maybe as an emergency job, so because you have pain or you cannot find somebody who can replace this tooth. This of course is a time limited damage which happens to your body, so I would say this is acceptable, and if you solve this problem by removing the tooth later on, you cannot have a lasting damage in your body. So on the other hand, you have to consider that root canal treatments are still taught at the universities. That doesn't mean that this should be done to every infected tooth. The infected tooth has to be removed because of the necrotic areas, there's no question. But nevertheless, it makes sense to do root canal treatments for some time to help the patient over a few weeks or months, and then this has to be fixed properly. This is my recommendation. Nowadays we have implants which allow very fast placement and usage of the implants. The teeth are removed, the implants are placed in the same appointment, and then you get the crown within 2-3 days. So this is a very short time span. Nowadays we don't have to wait for osseointegration. Modern implants don't have a healing time. They can work right away. So nowadays you can fix this problem quickly, and that's why I recommend that you will get those teeth removed. I've showed you in this video that root canals are a problem. You can see the problem in the surrounding bone around the root canal treated teeth. And what you see there is the truth. I mean, the bone doesn't lie. The bone has a problem. The bone creates hypermineralization. And from this hypermineralization, you can see that the intoxication and the infection is actually really taking place, even if you cannot measure it by means of laboratory medicine, for example.